This month, we decided in honor of Women's History Month to have a conversation about CAP and women's health. This is a topic that we get asked about a lot, that a lot of our therapists specialize in, and we're really excited to host a conversation about it. Journey Clinical is the #1 platform for psychedelic-assisted psychotherapy in the United States. So we have a community of therapists who offer ketamine-assisted psychotherapy in their private practice. And then Journey Clinical's in-house medical team handles all of the medical aspects of the treatment. So the intake, the prescription, the outcome monitoring. So it's a collaborative care model where Journey Clinical's medical team and therapists collaborate to treat their shared patient clients with CAP. And so if you don't have a CAP therapist yet, but you or a loved one is considering treatment, you can actually get matched with a Journey Clinical CAP provider in your local area, licensed in the state that you're in. Or if you're working with a therapist who is a Journey member, you can get started with them that way. And if you're a therapist, you're curious about treatment, we also have a lot of peer CAP options where you can experience CAP treatment as a patient with a peer. So CAP at Journey Clinical is always delivered in a therapeutic alliance. So it's unlike other ketamine treatment options where there isn't necessarily the psychotherapy portion. You're always going to be experiencing CAP with a licensed mental health professional supporting you with preparation, dosing, and integration at Journey Clinical. That's really important to mention. And it's also worth mentioning that we do have a medication management program. So if you are looking for other psychiatric medications to be prescribed for yourself as a patient or your clients, Journey Clinical's medical team can also prescribe other medications to support clients' mental health holistically. And it's also worth mentioning that we have an expanding list of insurance providers that help cover portions of the CAP treatment. And this is really helping us expand access across the country. So we're going to kick off with some introductions. We're going to hear from 3 Journey Clinical CAP providers, so therapists that are in private practice that offer ketamine-assisted psychotherapy. And we also are going to hear from Sam, who is a member of Journey Clinical's medical team, and she's going to help ground us in some of the science of ketamine so that we just have a foundational understanding about what it is. So I'm going to invite you to each introduce yourselves, so who you are, where you're based, and how CAP shows up specifically in your work with women. So we'll start with you, Jessica.
Hi, everybody. I'm so glad to be here. I'm in Santa Cruz, California. I'm a marriage and family therapist. I specialize in maternal mental health, and I'm an IFS person. So I integrate IFS parts work with my work with moms. And I just actually had my book come out in February. So this is the thing I'm super excited about right now. This book is called When Good Moms Feel Bad. And it's about using parts work with motherhood. It's for lay people and clinicians alike. And yeah, I'm really excited to have this conversation and learn some things and share what I've observed in using CAP with mothers. Thanks for having me.
Thanks, Jessica. Happy to have you here. Chrissy, you want to go next?
Yeah, hi, I'm Christy Powers. I'm a licensed marriage and therapist in San Diego in private practice. Recently just opened last year a group practice called Paradigm Wellness Collective. And my specialty is working with somatic psychedelic somatic therapy using cannabis synthetic. And I'm trained by Dr. Helen Bride in Canada. I also specialize in working with women coming out of high control religion, dealing with religious trauma, spiritual trauma, change issues, a lot of incorporating IFS and systems as well. I feel like it goes so perfectly with ketamine work. I also have a book coming out this year called Embodied Woman, and I talk a lot about that.
Hi, everyone. My name is Natasha. You can call me Natty. Either is fine. I live in New Jersey, but was born and raised in New York, and I'm licensed in both states. I have a solo private practice, I guess going into my 4th year of it. And I specialize in working with the LGBTQ plus community, people of color, relationships, sex, relational trauma. And I started working with Journey Clinical pretty early on in my private practice. So it's definitely been fun to see how that modality really, really helps and really works with the issues that I work with my clients on.
Hi, everyone. My name is Sam Stray. I am a psychiatric nurse practitioner, also certified in primary care. I'm located in Milwaukee, Wisconsin. I see our Journey patients in Wisconsin and Ohio. 2 of my specialties are substance use and trauma reprocessing. So I do have a different CAP practice where I do provide the ketamine as well. as seeing our clients here at Journey. And so I feel really passionate about assisting clients and really understanding what CAP is from a medical lens. And I also aim to serve those suffering from complex trauma disorders, reprocess and start to make sense of the behaviors that stem from complex trauma. So happy to be here.
One of the first things that we're going to do is jump into some case studies, so client examples of individuals that you've supported with CAP. But before we do, I would love, Sam, as always, for you to kick us off with just a brief overview of what's happening in the brain during ketamine-assisted psychotherapy and why this experience can be especially supportive for women who are processing trauma, identity shifts, major life transitions, but just grounding us in some of that medical context.
Yeah, of course. So ketamine is actually a dissociative anesthetic. So sometimes it gets thought of as a psychedelic, but it does have psychedelic-like properties, which is how it kind of falls into the psychedelic-assisted psychotherapy model. So ketamine is primarily an NMDA receptor antagonist. It works on glutamate neurons. And so how we can kind of understand that is ketamine temporarily loosens rigid synaptic patterns and promotes the growth of new connections. So most important thing there is this works different from SSRIs, so our selective serotonin reuptake inhibitors, antidepressants that typically get prescribed as first-line treatment for depression and anxiety. And they work more gradually through monoamines. So a little bit about how to kind of picture this in the brain. So when ketamine gets introduced, what we kind of know so far is that the neurons in our brains can start to grow these little branches called dendrites. And the dendrites are what have the capacity to connect one neuron to the next. And so if you think about, patterns, attachment trauma, childhood trauma, we start to develop these patterns early on in life, and they can turn into sort of like a rut. And so these patterns get kind of ingrained into the brain, and ketamine allows us to start potentially creating these new pathways to start thinking differently, to have different awarenesses. And the psychotherapy piece, the integration part of this, is really how we sort of solidify these new connections. So that's what's really important about the collaborative care model that we use. So a nice way to picture this is like a ski hill. So you've got a ski hill with the typical blue, green, black diamond runs, and those are the pathways that have just been ingrained over and over into the brain. Ketamine's like this fresh bed of snow that allows us to start seeing a different pathway that we can take. Now, those other pathways are still embedded in the ice underneath, but now we have this opportunity to see a new path and continue to take that path with the support of our therapists. So ketamine, just some other important pieces. So ketamine dampens amygdala reactivity. It also enhances prefrontal modulation. It creates a window of emotional lability with reduced defensive rigidity. And so when trauma material is accessed during this window of neuroplasticity, so after the ketamine's been introduced, the memory can be reconsolidated with new emotional associations. So what does that look like? Shame can shift to compassion. Fear can shift to meaning. What that can look like from the patient is like when they used to think like, this is how I am and nothing can change that, that can shift. And they can start to feel like they're no longer fused with their traumatic story. So for clinicians providing this treatment, one way to explain it to your patients and for our potential patients in the group, so ketamine temporarily quiets the part of the brain that keeps you stuck in your story. And it increases the brain's ability to form new connections. And so during that window, we can help your brain reorganize around new meaning. So thank you guys.
Thanks, Sam. I always really appreciate this grounding, and it's really helpful for us to have language that we can use with educating people about this work. That was a theme of our conversation a couple of months ago. And the other piece that can really help illuminate what CAP is for people is storytelling and case studies and examples. So that's what we're going to kick off into next. So I'm going to start with you, Natty, if that's all right with you. And I know that your work centers BIPoC and LGBTQIA plus communities and draws on traditions of healing justice. And so I'm curious, in your case example, what shifts you've seen when CAP is used to support women who are healing generational trauma or reclaiming their identity and intimacy.
Yeah, thank you. Do you want me to share a little bit about the case first and then answer the question? Okay.
Absolutely, please. Yeah, perfect.
Okay. So yeah, the client that I wanted to bring in today is a client that I've been seeing for 2.5 years now. She identifies as Black, queer, she's a cisgender woman in her late 30s. And the time that she came to me interested in CAP, she was experiencing just some aspects of her life that were feeling a little unstable. And so we began working together, building our therapeutic alliance for 2 years before we actually started doing the CAP work. And so we began doing ketamine-assisted psychotherapy at a juncture in her life where she felt grounded in her relationship with her partner and wanted to start exploring motherhood. And becoming a mother is kind of something that she always dreamed of, always, and often felt ashamed about the fact that she didn't pursue it earlier in life. So as we went into the exploration of what it might look like for her to become a parent, we had to really look at several factors that would make that journey particularly challenging for her. Number one, as a queer person in a relationship with another woman, we knew that she would face inherent challenges with the very complex and often inaccessible processes of family planning that are available to folks who can't conceive within their relationship. And we also knew that due to the age difference between her and her partner, their levels of readiness for parenthood were a little bit different. And lastly, she experiences chronic illness. She has a somewhat more uncommon form of diabetes that in sessions she refers to as type 1.5, and that makes it harder to sustain a safe pregnancy. So working with this client, I noticed that ketamine-assisted psychotherapy was able to help her arrive at just a deeper acceptance of the reality of her chronic health condition. And we really explored motherhood outside of the box, and she gained reverence for how she has been able to show up as like a motherly figure to her friends' children, and also ways that she's felt mothered by women who were not her biological mother growing up. And it's cool to see her just have generally less urgency around family planning, which has allowed her to focus on just tending to other aspects of her life with a focus on what she wants her life to look and feel like. And so I think that it took a lot of unlearning, a lot of narratives about who she should or should not be that were passed down from not only our like big systems in society, but also within her family, and passed down from generation to generation messages like, I should be silent, I should be subservient, my body is shameful. And I think that CAP really helped her to gain capacity for self-definition and for agency, and for challenging these narratives that she internalized and that really functioned as a form of intergenerational trauma. So I think that she's been able to sort of distance herself from those narratives and explore who she is outside of the confines of those narratives. I've seen her be able to look at her family history within the context of larger systems and understanding how and why trauma has moved through the generations in her family. And I've also seen her develop a lot more compassion for herself and for her family and her caretakers, which I think has just really, all in all, restored a lot of her capacity for intimacy that was disrupted by this trauma.
Wow, that was a really incredible example, Natty. Thank you so much for sharing that with us today. And a good example as well of how the preparation phase can look different depending on your relationship with the client. And that's a really key part of the therapeutic alliance, that you may be working with somebody for a long time before it feels ready to implement CAP with them. And that timeline can look different, but what's important is that there's a relationship and an alliance established between the therapist and the client, and that really helps support the outcomes as well. So thanks for sharing. Chrissy, I want to invite you to share a case study next.
Can you hear me better now?
Yes, totally better.
Yay. AirPods. Okay. Yeah, the client I want to talk about came in really wanting to get at the root of issues. Or a lot of times people will come and they say, I've done talk therapy for years and I need to, there's something I can't name or touch. And this person had an injury, an attachment injury with a church and relationships within the church. They used to work at a church. And so pretty quickly on, I knew like, okay, there's a lot more here than just the church hurt. There was a mention of child abuse, particularly with her mother. And so this person was very high achieving, found very much her identity in that, and was exhausted and burnt out and was like, I can't keep going at this pace, but I don't know how to be any other way. So doing this work with her, number one, my philosophy, I think a lot of times there's a different philosophy with psychedelic therapy or ketamine therapy, which is sort of like, one is, okay, I'm going to put you in a canoe and send you down the river and I'll see you on the other side. The other is I'll put you in the canoe and I'll run alongside the riverbank with you. And then there's one where I'll put you in the canoe and then I'm going to get in the canoe with you and I'm going to go down the river with you. And that's the specific type of model that I like to use, where it's very attuned. And I'm sometimes, even as the therapist, becoming the solution. Like I might be the mother, I might be the father, and we consent for everything. We consent for touch. We talk about everything before, but oftentimes in those states, that's what the body actually needs, is to be touched or held. And so in this particular case, I'm really inserting myself into the session, into their journey with them. A lot of times with ketamine, I know now, like, okay, if they're really heavily into it, like right after they take the medicine, not going to be like, tell me where you're at, bring me in it, because they're like, I can't even talk, just be quiet. And I'm okay with that too. But I know now, like the flow of the medicine, and like if I see something shift in the body, I'll be like, what's coming up for you? Can you pull me into that with you? Can I be in that with you? Can you see me there? How far away am I? Can I be nearer with you in that? Because the idea is that when we're traumatized, we are usually alone in that and feel like no one else has seen it. And so what the body can register in these sessions is that now I'm not alone in it. I survived it. I hiked Mount Everest. I found all my parts. We hiked Mount Everest together. My therapist was there with me. She saw it all and we made it to the other side. So with this particular client, using KAP for over a year, we really got access to the inner child wound, which definitely went all the way back to childhood with the mother and the abuse. And it was too big for this person to even name when they came in. So very gently, we're still approaching it to look at it. It really does take like this. KAP is so beautiful with imagery. It's like a dream. And so you kind of, as a therapist, learn how to interpret the dreams and okay, what is this big black dark cloud that okay, oh yeah, you can't look at it. Okay, I'm right there with you. Do you want me to look at it? Okay, I can look at it. Okay, and then can we turn together? Or, it's such a beautiful medicine to get to work with your clients. And in this particular, one of the sessions I can tell you about, she was like sort of trying to find her inner child. And we ended up at a wall and she was like, there's a wall. I can't get beyond the wall. I was like, oh, yeah, okay. Yeah, I see this wall too. And so we end up climbing the wall together and we're sitting on the wall forever. And then she's finally like, it's just too far away. I was like, yeah. She's like, I'm going to have to run to find her. And she's like, and I hate running. And I was like, well, I like running. And she was like, can we run together? And so we ran. And then immediately, like the next minute, she's like, oh my gosh, we're there. I can see her. And so, and then also what you can do with ketamine and psychedelic therapy is work with disassociation, because that happens a lot too in this. Is we end up like, she was so close to her inner child and all of a sudden she's taken out of it to this white space, which is her disassociation. And so we just lovingly go to the white space and I go with her. And so that's a really big part of this work for me as well, is to go to the places where people had to go to get safe. And when you do that, it's like, okay, I'm not alone in the disassociation either. And it's not bad. I knew how to get safe. And then the next minute, she's right there looking at her inner child, holding her, saying, you don't have to do this alone. As like, I'm holding her, she's holding her inner child. And what it looks like in integration then is the hardest part, right? It's like, yes, these are all wonderful experiences, but if we don't integrate them, nothing changes. So that looks like building self-compassion and saying no or asking for help, which is extremely hard for her. Finding her identity has been really challenging outside of CAP because it's almost like she's just unraveled. And that for me as a clinician I've had to build a sturdiness around that to say, yep, this is part of the process. Like, you are unraveling and you get to rebuild what it looks like to be you. And I'm still right here in this with you. So also, that's why I also think it's really important to do your own work with CAP if you're going to be a CAP physician, because I'm like, yes, I know what that feels like. Been there myself. So yeah. And this was a pretty high dose. Someone just asked, like, oh, what doses is this? This is about 400 milligrams, and she's taking the lozenge. So that's probably one of my favorite cases so far.
That is so interesting, Chrissy. And I feel like we don't hear enough stories about what that journey can look like, especially with the collaboration with the therapist, you being right in there with somebody, which of course separates this from having your individual psychedelic experience and that work that you can actually do with them. And we get so many questions from patients of what does this feel like? And it's a difficult topic to broach because it's of course different for every person, but just knowing that you have that support of you right in the canoe with them, I think can help people feel really safe. So I appreciate that story.
Thanks.
Thank you. So we spoke to Natty and Chrissy. I'm going to ask Jessica, you to share your story now.
I thought I would share about the groups I run for moms where we work with mom parts. Sometimes I do this with individuals, but I think to kind of piggybacking on what Chrissy was sharing about, people, moms included, feel pretty lonely and suffering or struggling or, psychological distress can feel like something that they're really alone in. So having moms groups feels like a really beautiful way to undo some of that aloneness. And one way that I like to run groups is to give everyone a deck of these mom parts cards that I use, where we'll do a meditation together, and then moms will go through the deck and pick their parts, and they'll lay them out like superwoman, responsible, resentful, whatever parts have been really emerging in their lives and in the meditation that they were guided through. And then all the people in the room, or if we're online together, it'll be all the people in the Zoom room have their parts laid out and really get a chance to get to know those parts and hear their stories and then do their dosing session. We do some other steps in there too, but just to give you a sense of how that might go. They'll then, go on their journey, and it's really beautiful when everyone's in a room together. And then coming out of the journey, people do some journaling and then we start talking. And the commonalities that moms discover in what they share, regardless of if they, they're empty nesters and their kids are off doing their own thing, or they're moms of toddlers. There's still, it doesn't matter kind of socioeconomic stuff or where you're from. Motherhood has such universal kinds of predictable parts that moms experience. And discovering that and hearing that you're not the only one who's resentful or who has rage or who feels, panic or whatever it is, can just be so normalizing, along with the experience of the ketamine, which, because I'll do these groups without ketamine sometimes too, but when the medicine is in the mix, there's just this huge kind of lifting off of that inner critic quality that we don't even realize is so permeating everything we do, especially in motherhood. I think there's really harsh kind of eyes on whether or not we're doing the right thing for our kids, whether we're good enough moms, whether we should be doing things differently, or our kids' poor behavior is our fault because we didn't do it right. So that inner critic, I really noticed that the medicine helps that kind of melt away, and moms can then become so much more open-hearted and curious about their experience, and then witness other moms having that same orientation toward them, which is like double whammy of healing.
Thank you, Jessica. Thanks for sharing specifically about these groups that you host, and how I know we have some questions also in the chat, some curiosity about what that looks like. So we'll save some time at the end for you to share about those groups, and for you, Natty and Chrissy, to share about the work that you're doing ongoing in your practice. I know that Sam, you maybe wanted to add a little bit to your introduction about specifically women's health and CAP.
Yeah, friends, I just totally skipped my whole thing about how this can be helpful for our women. So just briefly wanted to share, ketamine can be especially useful for women who are processing trauma as a way to better understand the behaviors that stem from our trauma. And so, like, understanding where that comes from, and ketamine can sometimes increase that awareness. So, this increased awareness is where you can think of those new pathways that I was talking about being formed. So, a different way to see your past and a way to see a new pathway forward. So, as we know, ketamine itself isn't a magic fix. It certainly can temporarily relieve symptoms. But ketamine paired with the psychotherapy from just like these amazing women therapists that we're working with now and these wonderful people, we can start to become more aware of our internal state. So this may be related to abuse, generational trauma, identity shifts with life stage changes, like Jessica just spoke about, hormonal changes, gender identity. And so becoming more aware of what's happening inside and where the trauma stems from, paired with being seen by your therapist and your medical provider, can allow someone to shift the narrative around previous fixed beliefs.
Thank you so much, Sam. So I wanted to ask a little bit about a topic that we can have a whole dedicated conversation about, which is somatic work and KAP. Maybe before we get into that, or whoever wants to go first, or if we could just share a little bit, what do we mean by somatic work? I know that we have a lot of clinicians in the room, but we may also have some folks who don't necessarily know what we mean by that. So maybe we can give some examples of what types of somatic practices you might engage in with your work.
Yeah, when I say somatic, someone already in the chat, Katie, was like, oh, someone else that's another PSIP trained clinician. Yeah, PSIP is Psychedelic Somatic Institute of Psychotherapy. So what we're working with when I say somatics is the nervous system, and we're using sensation to find what is the body saying, basically. KAP and other psychedelic somatic work is really bottom-up approach. We're listening to the body. So oftentimes I will say, like, what are you noticing inside? Okay, I'm noticing my heartbeat. It's really, most of the time people start with that. And then we go deeper into like, okay, how fast is the heartbeat? Oh, okay. Oh yeah. I name what I see as well. Like, I see your arm twitching, and I say, okay, oh, that was a really big deep breath. What happened there? And so I'm really getting people associated with what's happening inside and turning down or dialing down the secondary consciousness, which is how we make meaning out of it, which is what I see a lot of times women are wanting to already like name it and, oh, but this doesn't make sense. It wasn't really that bad. But then I'm like, oh, but your body's really telling us it was that bad. And oh, you're tensed up like this. Oh, is that how you had to get safe? You had to get smaller. Okay. Oh yeah, let's get even smaller. Yes, let's let the body do what it wants to do. So it's really just letting the body tell the story, and giving women permission to do that. Is such a beautiful thing, I think, because that's what the medicine does, but it's also you as a therapist gets to give them that permission to say, oftentimes I'll do this work even with younger women that are in their 20s, and they'll not even know, like, this, my inner child was so scared. I was so scared of my dad. And even though I have a great relationship with him now, or he, it's like, okay, we get to hear from what your experience was through the body. So when I say somatic work, I'm really talking about that. And I'm talking about nervous system states. Like, oh, this part of you, if we're using IFS language, is stuck in that nervous system state, fight or flight, or state 2, which is, I'm looking for all my resources, to fight this thing, and letting the body feel that in order to move through it. So I don't know if I answered the question right, but that's how I answer somatic work.
Yeah, that's a really helpful explanation. And you included in your response a little bit about how you're working with that specifically with KAP and supporting women. And of course, it's a unique experience as well, because ketamine is also a dissociative anesthetic. And so there's a somatic quality to it that's unique from other things, and they're coming back into their body at the end of their journey, and there's a lot to say there. So I'll invite you to add anything. Natty, did you have anything you wanted to add, or Jessica?
Yeah, sure. I thought that was a very beautiful explanation of what somatic therapy means, what it looks like. And when I explain to my clients why that's so important, I like to contextualize it within the broader fact of we live in a society that in a lot of ways promotes us from disconnecting from ourselves, whether intentional or not. I think many ways intentional. And an example that I, just saw earlier today was on TikTok, people kind of showing how they turn to ChatGPT to ask, like, what should I eat today? Or what should I text this person back? Rather than kind of checking in with themselves and what their desires are and what their body might be telling them they want or how they might want to proceed in a situation. So helpful tools, but also in a lot of ways does create a kind of disconnection from ourselves. So I explain to my clients that that's kind of one of the reasons why I feel like building somatic awareness is incredibly important. And I think that, yeah, we talk about how it's important to kind of track what's happening in your body, both to the extent that you can in the medicine sessions, but also in the integration sessions when we're processing what happened in those medicine sessions and what sensations might be coming up for you as you're even talking about what came up in the journey and what do you think your body is trying to tell you there by transmitting these sensations to you. And so yeah, I think that there are some very natural bodily responses that psychedelics can activate. We have a lot of memories, traumatic memories that are stored in our body. Like Chrissy said, fight or flight responses can definitely come up. And I think that I notice my clients kind of just in general have a heightened sensory awareness after medicine sessions, just across the board. So doing somatic work together in a session can definitely help, increase that somatic awareness, which in turn gives more tools to regulate the nervous system and really processing that bodily trauma, the way that trauma gets stored in our bodies. And I think that has really helped clients of mine establish new ways to anchor the insights that they're getting in the medicine sessions into their daily life with continued somatic awareness practices. Like I facilitate breath work for my clients in our sessions. And I find that to be a really concrete tool to give them to take into their daily life. And Lizzie, you had mentioned identity affirming care earlier as well. And that is another piece that is so essential to my work with supporting women clients in integrating their psychedelic experiences. As I mentioned earlier, I am a clinician who works with various marginalized populations, including people of color, women of color, queer women, trans women. Identity affirming care to me really means acknowledging the social and cultural and racial and gender and all other identity related factors that come together to really shape a person's lived experience. And so doing integration work with identity affirming care in mind means respecting and honoring that the client's realities is made up of all of these different identities and experiences coming together and taking that into account when making meaning of their psychedelic experiences, rather than me trying to force some kind of universal interpretation of the insights that they might have gotten. And so ultimately, it's my hope that centering my clients' identities in the integration work will allow them to reframe the insights that they're getting in a way that really supports their agency and self-definition. And I feel like the somatic work and the identity affirming care really just go hand in hand and help people become more embodied rather than staying in the brain and staying intellectual.
Well, maybe I'll just add, those are such beautiful descriptions. And I would just add that my experience with KAP is that as that inner critic kind of embedded part of us lifts off, we are sort of restored to something much more true to our nature. One of the qualities that I see emerge in people really spontaneously and kind of across the board is curiosity in their own experience and genuine interest in what's happening in me that is pretty novel, I think, for mothers and for women whose energy is really claimed by patriarchy and by caretaking duties. We're conditioned to have our energy on other people. I think CAP is such a gift because it brings our energy and our attention into our interior in a way that really gives moms an opportunity to find themselves intriguing and precious and compelling. And then as that starts to, I mean, it doesn't take much. I also noticed just a couple of minutes in that space of, ooh, I like myself, or I'm interested in myself, is incredibly restorative and has long-lasting benefits, some of which over time really translate into self-trust and trusting the body again, feeling willing to be in the body again, wanting to take care of the body because it's now kind of like something's been reconnected inside. This is me, and I'm precious and interesting to myself. I'm not just here to be of service to others.
Thank you all for that. And we've been talking a little bit about the work that happens in integration and emphasizing the importance of that work. Could you share a little bit about what it's been like to work with some of your CAP clients in integration, what that work looks like, and how you bring them through that process of the CAP treatment into their integration into life?
Sure, I could start. I notice it sort of takes care of itself with clients that I work with over time. This one client I had who I'd been seeing for a very long time, I'm going to say 12, 13 years, who had a big trauma history, sexual abuse in her childhood, and she became a mother, and I started seeing her when her first child was a baby. And she made progress in those years, but then once I introduced ketamine, the first journey she took just blew. It's very much like what Sam was talking about. She had new snow down for the first time, and she could really look at her experience in a much more resourced way. I remember in that first journey, she just kept saying, as she was integrating afterwards, we sat together and integrated for a session afterwards and then on and on. But that first moment where she realized, like, oh my gosh, I really love my husband. And she's like, don't tell him. She had a grudge against him, and she wanted to keep something in her, wanted to keep some power by not letting him know that in the journey she had realized he is a true love. He's such a resource for me. He's really here for me, and I can trust him. She just like melted, something melted even before she was ready for it to. This other part of her was like, hold on a second. We gotta keep that grudge intact. But over time, that just kept coming up, and we just kept saying, okay, we won't tell him, but he's your true love. And that same kind of feeling of her being able to have such an expansive state. It has been such a joy as a clinician to sit with someone who I've known for so long, witnessed feeling really trapped by her old ski tracks, and now having this fresh snow that even if she hasn't used any medicine for months, she still has that kind of flexibility and bigger view. It's sustained. And I can tell you, because again, of the length of time I worked with her, the contrast is so remarkable and so rewarding. Like she's not the same person. I think she's had 2 journeys is all, and wildly different. So we continue to integrate, and it just keeps opening and opening even without more medicine.
Yeah, I can speak to that as well. And I was going to answer in the chat, someone saying, do you have any spiritual experiences, or do those happen in CAP sessions? And absolutely, yes. I would even argue that every session is spiritual, but I have had deceased loved ones come into the client's experience and say, oh my gosh, my grandmother's here and she's saying this and she's telling me how much she loves me, and I can feel that love again. I can get access to it. And so I very much think those are very, very real experiences. I've also had a client who had one CAP session, and she got in touch with her highest self, which felt like this like goddess coming down from heaven. And she was like, saw the heavens parting, and this real authentic version of herself really touching her. And that I will use in integration when I notice that she slips back into old patterns of like high performing, overproduction, finding her worth in that. And I'll bring that back up and say, now, where are you acting from? Is this from that highest self that you experienced, or is this from that part of you that's so afraid of dropping the ball or not being productive? And quickly it works like that. They're just, oh, yeah, I know. I remember that feeling, and I get in touch with it. And that's what I love about the journeys, is that they stay with you. You remember it, even if you don't remember every detail, your body does. And it's like, it makes it easier to access as a therapist because you also remember it for them. So I will even tell them like, hey, I was there. I remember what it felt like when you said you felt self-love for the first time. And I remember the look on your face, and I remember how I felt too. So I will oftentimes bring those experiences back into session even after. And that was just one session. Yeah.
Yeah, I can share as well. Like everyone's sharing, I think integration sessions are really a collaborative conversation rather than like an analysis of what happened and what does it mean. And I think that for each client, integration sessions look so different. I really just encourage the client to lead with storytelling in whatever way that looks for them. So I have a KAP client who is an artist, has been an artist her whole life. And so when we were exploring questions like, what stood out from the experience, or did any images come up, she will make art. She will make art in the session to help me see what she saw, to help me experience what she experienced. And I find that to be so powerful because she's using a superpower of hers that she already has to process her experience and make sense of it, and to let me into that in a way that feels really deep and meaningful as well. And I think that also in integration sessions, like I always start the medicine sessions with the sort of establishing of intentions and establishing what you're hoping this session will bring or bring up for you. And so the integration session is really a lot of returning back to that, returning back to what it is they already named was important for them to explore in the ketamine session. And I find that really helpful too. For example, if a client's intention that they set is, I really want to explore how it's so hard for me to take care of myself. I put people before me all the time. I just don't know how to take care of myself. And then we have the session and they go through the journey and they gain insights. In our integration session, I'll really focus the conversation around how did that psychedelic experience you had change anything about the way that you might live or relate or care for yourself, and just really tying it directly back to that intention that they set. And I find that to be really helpful for us to return to, because then they establish goals based off of that we can work together to help them remain accountable to.
Thank you all so much. I did want to give you all a chance to just share a little bit about where your practice is based, and what type of work you're doing in case anyone here wants to get connected to you. So if you could just take turns, maybe start with Jessica and share a little bit about that.
I train other therapists and practitioners in a curriculum I developed called the Mother-Centered Approach. And it's based on the same stuff in my book, and this idea that moms have parts, and how can we be with moms and their parts in a way that's non-pathologizing and helps them heal. And so in that training, I also offer, along with it, KAP groups for moms and training therapists in how to run those groups, and also offering those groups for moms. So I do more stuff for people who are on the learning side these days than moms themselves. But you can find all that stuff on my website, jessicasorcy.com. Thank you.
And I am based out of San Diego, and I have an office in Encinitas where I see clients in person 2 days a week. So I do KAP sessions. Then I also do occasional intensives in Los Angeles and Venice Beach, at a beautiful home where I find oftentimes that moms, when they want to do this work, need more than just a day. And so then I sort of make it into a long weekend for them so that they can like ease back into home life and not be so jarred. And so that's more of like a retreat style. And that's just as needed as desired. So if anybody is interested, they can reach out to me through my website, christypowers.com. And yeah, I do online sessions as well, and love working with other therapists that are interested in this work, that are like wanting to practice it first before they enter into like training. So that's one of my favorite things to do as well.
And like I mentioned earlier, I'm licensed in New York and New Jersey, and I do KAP largely with individuals remotely. If you know anyone in those states who is hoping to have a ketamine therapy experience from the comfort of their own home, I'm their person. And my website, if you would like to learn more about my practice or get in touch, is wildestdreamstherapy.com. And I'll put that in the chat as well.
Incredible. Well, thank you all for your insights today, and I hope everyone will get in touch with you all. And so again, this is a monthly webinar. We hope you'll come and join the next conversation that we're having. Stay in touch. Appreciate all of your feedback.